Well, the state health assessment is really comes out of some best practices that many health departments are using these days, in which we're going through an accreditation process to help improve the way we do business as a health department. And part of that includes developing a formal state health assessment where we really reach out to all the communities in Arizona and get together and prioritize those health impacts that have the biggest impact in Arizona, and then use that information to develop a state health improvement plan later down the road. So it's really part of a full quality improvement process that we're using and the county health departments are using to improve our effectiveness. Well, it's really a collaborative effort amongst a whole host of stakeholders in Arizona. In fact, more than 10,000 people were involved with developing both the community health assessments and also the state health assessment. And by the way, the nonprofit hospitals in Arizona also did a community needs assessment. So it's really a collaboration amongst folks at the community level, building those community health assessments and then rolling that up into a larger state health assessment, and then pulling in some additional data sources with some of that unique statewide information. The state health assessment is available now for use. Anybody who's involved in the public health system can start using that data to help design public health interventions to improve the health status of Arizonans. But it's also a really important tool in building a state health improvement plan, which is really our ultimate goal, to not just have the surveillance data to figure out what are the biggest health impacts in Arizona, but be able to put that together in an executable document that will help us to really design tools that can be used off the shelf by a whole host of folks to improve the health status of Arizona. So, for example, one of the things that we identified in the state health assessment is that when you break down the smoking rates across Arizona by income, you see something that is really pretty astonishing, that for folks that make over $75,000 a year, roughly 5 to 7% of that population smokes. Pretty low smoking rate. But when you start looking at the Medicaid qualified population, in other words, families that are living below the poverty level, we see that upwards of 30% of that population smoke cigarettes in Arizona. So that's what we identified in the state health assessment. Our next task is to translate that in our state health improvement plan into targeted and direct interventions for low-income populations to help pull them off of that nicotine addiction and give them the resources and tools they need so that they can become smoke-free. But until you do that full assessment of the population and know where your health disparities lie, you're really working in the dark and you can't design effective interventions. So that's just one example of ways that we can use the state health assessment to develop interventions in a real targeted way that are that brings together a thoughtful process that use evidence-based tools. The first thing to do is to go to our website and take a look at the state health assessment. And no matter where you are in the public health system or where you are as a citizen of Arizona, there's going to be interesting information that's available about your community in the state health assessment. So really start at the community level, look at the information and the data that we have. We will always be looking to get new and more contemporary information. So if you look at the state health assessment and you think that you may have identified a data source or a public health issue that's not addressed in the assessment, we've got an online tool so that you can go and give us some electronic comments about ways that we can improve the state health assessment. And then the next step is to really stay engaged not just through the state health assessment, but as we develop the state health improvement plan, and really engage with your county health department or your nonprofit hospital or your community health center, and help us to be creative about the kinds of tools that we could implement, strategies and tactics again, over time, so that we can use our resources as effectively as possible to really start moving the dial on health here in Arizona.